Hi, I'm Kris Ware. I'm an orthopedic surgeon subspecializing in sports medicine at Orthopedic Associates of Hartford. I grew up in Glastonbury, Connecticut, went to UConn for my undergraduate education, and there I developed a passion for health and wellness. That led me down the road to physical therapy as my first career choice. I earned my Bachelor's of Science and Master's of Science from UConn in physical therapy, and later my Doctorate of Physical Therapy from MGH Institute in Boston. I went on to practice as a physical therapist working with athletes for 6 years. And during that time I really gained an appreciation for how rewarding it is to take care of athletes and get them back to their highest level of competition. During that time I also worked with a group of orthopedic surgeons that inspired me to go back to school and pursue orthopedic surgery as a career. I went to the University of Vermont for medical school, and then came back home to Connecticut to UConn for my residency. I then went on to a fellowship training at Brown University, and there I had the opportunity to work with athletes at the college and professional level. My history of being a previous physical therapist gives me a better perspective on the entire spectrum of care, ranging from preventative care, non-operative treatment, as well as the post-operative rehabilitation. I think I have a better understanding of what athletes go through when they have injuries and what happens during their rehabilitation. My training involved taking care of athletes from head to toe, but the areas that I like to focus on are hip, knee, and shoulder. And those are areas that I treat both operatively and non-operatively. Frequently when I meet with athletes after injury, we will go through an examination and make a determination about what's the most appropriate course of treatment. In many cases, physical therapy becomes the treatment of choice. In cases where conservative treatment would not be effective, then we go down, we then have the discussion of operative treatment. I provide arthroscopic surgery for the shoulder, hip, and knee, as well as open procedures that may be needed in some cases. While I was at Brown University, I had the opportunity to work with outstanding mentors that taught me how to appropriately treat athletes at the college and professional level. And this has really helped me with how I manage people at this point. I enjoy taking care of athletes because there's a lot of reward in getting someone back to their highest level of competition. But I find it equally rewarding taking care of the weekend warrior, the older recreational athlete, or the manual laborer that's interested in getting back to whatever they need to do for their quality of life. I take care of a lot of athletes that are my age. They're 40 years old, they want to maintain their fitness level and their activity until they're 70, and I get it because I'm the same way. There's no better way to treat an athletic injury than preventing it from happening. And to do that, it really takes a team approach. It involves physical therapists, athletic trainers, coaches, as well as physicians. It's no longer enough to say you need to stretch and warm up before activity to prevent injury. I feel fortunate that I have a great network of physical therapists and athletic trainers that I work closely with, and with them we're able to look at strategies to prevent injuries. We also have technology now such as pre-season evaluation tools, as well as motion analysis that can help us to predict who may be at risk for developing an injury.